Have you been trying to get pregnant months after months and yet nothing is happening? You have prayed, fast, and even lose hope, and it seems like something is actually wrong somewhere. But if I tell you that sometimes it might not even be a serious medical problem, it might be from your daily habits. In today's video, we're going to be looking at 8 habits that can delay your chances of getting pregnant. Note that getting pregnant is not all about having sex. Your body needs to be in the right condition, both hormonally, physically, and mentally. And the thing is that both men and women are doing things every day that are reducing their chances of conception without them realizing it. So all you have to do is just watch the end of this video because this topic is going to blow your mind. Without wasting much of your time, grab your popcorn and let's get started. Now let's look at one of the most biggest issue, which is known as poor knowledge of ovulation. Many women today don't know how to calculate their ovulation. They don't even know their menstrual length. Talk more of knowing how to calculate their ovulation. Now, ovulation is the release of an egg from the ovary. This is the perfect time for you to conceive as a woman. Now, if you're not having sex during your fertile days, which is from 3 to 5 days before your ovulation or your ovulation day, your chance of getting pregnant might reduce. A couple came to the hospital and was complaining that they have been married for over 3 good years and yet they have not yet conceived a child. Then the doctor now went straight and asked the woman, when is your ovulation? And then she said, she had been hearing of ovulation, but she don't know how to calculate her ovulation. Then he now asked her, okay, when is your menstrual length? And then she said, yes, that she knows her menstrual length, that her menstrual length is 28 days, but she don't know how to calculate her ovulation. Then the doctor now put them through and started teaching this woman how to calculate her ovulation. And the doctor now find out that this couple, anytime that this woman is ovulating, the husband is not always at home because the husband used to go to work and come back every weekend. Now, once the husband come back that weekend, they'll be having sex back to back, thinking that they will conceive, not knowing that that's not the right time. So he now put them through and explain everything for them. The husband now have to change his work schedule. Anytime that his wife is ovulating, he usually come back home, like he's usually around when his wife is ovulating. And to the glory of God, it didn't take them 2 months, this woman conceived. The man came to the hospital and they were all jubilating, celebrating that his wife is now pregnant. So you can see that poor timing can affect or delay your chances of getting pregnant. Now let's look at the second point, which is known as stress. Now, stress is one of the most biggest common causes of infertility today, and many men and women don't usually pay much attention to it. Now, once your body is under stress for a long period of time, the body begins to release a stress hormone called cortisol. And the work of this cortisol is to manage stress, manage high blood pressure, and also manage blood sugar. But high cortisol level in the body can interfere with your reproductive health, such as your testosterone in men, progesterone in women, and estrogen. Stress sometimes can stop ovulation and also causes irregular cycle. Now let me use myself as a practical example. My period usually lasts for 4 good days, but any month that I overstress myself, my period becomes irregular. It only lasts for good 2 days. So you can see that stress can affect your fertility a lot in both men and women. And then the third point is poor nutrition. Now what you eat matters a lot. If your meal is full of junk food, processed food, sugary food, all these food that contain unhealthy fats, your body may struggle to support pregnancy because your body needs essential nutrients in the body such as zinc, iron, and healthy fats. But if your body lacks any of these nutrients, or if your body lacks these nutrients, pregnancy might be delayed. Think of your body as a room preparing for a baby. Now, if that room is unhealthy, implantation may not occur. Now, let's look at the fourth point, which is smoking and drinking excessive alcohol. This lifestyle has really damaged a lot of people and it has caused infertility for both men and women. Smoking and drinking excessive alcohol can damage your egg and also your sperm health. Smoking and drinking excessive alcohol do not only damage your egg, it can cause miscarriage during pregnancy. So you can see that smoking and drinking excessive alcohol should be completely avoided. And the fifth point is weight issue. Being overweight or underweight can disturb your menstrual cycle. Now, too much fat can increase estrogen level, while being underweight can stop your ovulation. And then the sixth is ignoring medical checkup. Sometimes it may not even be your daily habit. It might be that you may have some health conditions like hormonal imbalance, infections, and the rest. So if you are ignoring these health conditions and you not go to the hospital for proper checkup, it may increase the risk of infertility. So if you have been trying to get pregnant for a while, it is advisable for you to seek medical attention immediately. And the seventh is poor sleep. Sleep can also affect your hormone a lot, which can cause hormonal imbalance. And lastly is excessive intake of caffeine. Yes, excessive intake of caffeine can lead to infertility in both men and women. So if you have been trying to conceive, don't panic. Change your lifestyle and seek medical attention if you have been trying for a while and it's not working. We have come to the end of this video, and if you are new here, you're highly welcome to Ruth Health Space. I'm Ruth by name. On this channel, I share health tips like sex education, pregnancy, general health topic concerning men and women. So if this sounds like something you like, subscribe for more health tips coming your way, and don't forget to give this video a big thumbs up. And as always, see you all in my next video. Bye.